Hey everyone, welcome back to another episode of the Blessing Health System podcast. Today's guest is Blessing Hospital neurosurgeon Dr. Ryan Brennan. Prior to joining Blessing, Dr. Brennan served as Chief of Neurosurgical Operations and Director of Trauma Critical Care for the U.S. Forces in Afghanistan. Dr. Brennan, thanks for joining us.
Yeah, thanks for having me. I'm excited to be here.
To start off, could we hear a little bit of your story and just how you ended up here at Blessing?
Sure. Well, first, thanks to all of Quincy for welcoming myself and my family so graciously. It's been a really wonderful transition. This is my first post-Army job. So we spent a lot of time trying to figure out really what we were looking for and what mattered to us as a family. And, you know, I'm sort of blessed with just the most amazing wife in the world who I met actually in high school. So we've been together forever. But when we talked about what we were looking for, it really sort of came down to, you know, it doesn't matter necessarily title or position or sort of, you know, public eye access sort of thing. What matters is we wanted to be in a place where we could have an impact on a community and also a place that valued sort of family. And Blessing was really just kind of amazing about helping us find that balance. I looked at all over the place at, you know, sort of all around the country, from big private practice to little tiny, you know, shops in rural parts of the country to major cities and things like that. And I just had a really great feeling about Blessing because the things that they emphasized most were the quality of the care, not how many patients can you churn out and how many cases can you get done in a day. It was about how good are the cases going to be and what is the quality of the care that you're going to provide. And that resonated with me because I think I think there's a very fine line between treating patients and caring for people, and it's something that I've sort of learned over the years in the military and sort of just in my own personal experience. And the way that I believe patients should be cared for is that I want to treat you like your family, and so you have a difference in an impact on the community that you're living in, one that you can sort of plant roots in, and that's been something we've been really thrilled about here. In our transition from the military. But you know, my wife and I, we met in high school. Off we went to our, you know, college. We went to Indiana for undergrad, both of us, and then we went off to graduate school. She did an MBA, and I ended up going to med school at Indianapolis at IU. And so once that was done, we then went over to Cleveland, Ohio, where I was trained in neurosurgery at the Cleveland Clinic. I spent 7 years there from 2009 to 2016. And while I was there, I was able to actually, you know, do some fun things. You know, obviously I learned a ton about neurosurgery, but I was able to do an enfolded spine fellowship. I did critical care fellowships and was able to do some fun research and really sort of dig into that. Once that was done, obviously, then it was time for me to head to active duty. And I'm an Army officer. Just got out in July. I was a lieutenant colonel, so we went out to Washington State to Fort Lewis, Washington, where I was stationed from 2016 to 2024, and was there until we came here. So it was a pretty great experience overall. A lot of fun things. You know, you get to serve your country and, you know, did some deployments and things like that. So,
yeah. So I saw on your profile there that you went to you did some training there at Cleveland Clinic, and that's where I went to high school. I went to college at Cleveland State University.
Oh, wonderful!
So
you know the area.
Yeah, I'm familiar with the area.
You're familiar with.
Yeah, a little bit different over here, but yeah, it's pretty interesting.
Yeah, you know, Cleveland's not a bad town actually. It's got a lot of good food, and you know, there's some sports that you can cheer for. Mm-hmm. They're a little heartbreaking at times.
Oh yeah, big time.
I mean, you know, that's what you get when you cheer for the Cleveland Browns.
Yeah. So I wanted to talk a little bit about, and you mentioned it there briefly, when your family kind of has to move around. How do you manage that? Like you have a new city, new place, you know, you're starting a new job even here in Quincy, or whether that be in the Army or wherever. How does that transition typically go for you?
Yeah, that's a great question, actually. For me, I'm sort of an easygoing guy. I kind of grow where you're planted, right? So deployment, you know, it doesn't really bother you that much. You sort of just go and you grow where you're planted. That's one of the things maybe that the Army teaches you, or maybe just is innate to who you are as a person. I don't know. But for me, I think if I know that my wife and kids are succeeding and thriving, then for me, the rest is easy. That's there's a great public speaker, Simon Sinek, who talks about what's your why and what's your motivation for doing what you do. And that's something that they actually make you sit down and watch his presentations in the Army. Effectively, sort of understanding what it is that motivates a person to have the feelings, thoughts, motivations, values that they have. And for, like I've sort of already commented on, mine are my family, right? I'm a very family-based guy. And so I think those transitions that you talked about are easier for me when I know that they're doing well. And, folks here, it's sort of the Midwest charm. It was actually one of the things my wife and I kind of laughed about and joked about was how kind people are in the Midwest. And of course, we were from the Midwest, but we've spent enough time out of it that I think we sort of forgot how kind people will be in a smaller town. And sort of that value, because I was driving down, I think it was 36th Street, and I was driving down the road. It was like 7 a.m. And there were no other people, no other cars, and some guy in a truck came opposite, me in the opposite lane, driving opposite direction. And the guy waved at me, and I was looking around, and maybe he saw somebody out on the lawns, and I realized the guy was just being nice at 7 a.m. and waving to a fellow driver, and I was like, geez, that's great. And people, everybody from the, blessing administration to the nursing staff to the OR staff to our neighbors and our, the kids that my kids go to school with. And everybody's been really, really welcoming and just sort of extraordinarily kind. Part of that transition, I like to coach my kids' sports. And that was one of the things Blessing said was good. I said, hey, listen, I want to be able to coach their sports in the fall, their soccer team. And they said, sure, we support that. We want you to be part of the community and lean into it because, you represent us out in the community. And if you're a contributing member and helping lift up the community, then that reflects positively on the institute, the organization and obviously on yourself and your family. And so, leaning into things like that has made the transition a little easier. My kids got to know some other kids on the teams, and that made school a little less scary. And like I said, people have just been really kind and very, very welcoming. So, I mean, truthfully, I don't think we could ask for a sort of a nicer, warmer, more hospitable reception than what we got. I mean, I think certainly it would have been a very different experience going to some of the other places that I had boiled it down to, sort of the top 3 places that I looked at. The other 2 are in major cities at sort of much larger institutions, and I. Just by nature of being large cities and big institutions, that sort of welcome wouldn't have happened. And so it was, very, very nice start to our time and our new adventure, our new life here in Quincy. So.
Yeah, me and my wife talk about it because she's from a smaller town where there's more of that Midwestern charm, and then I'm more familiar with like the Cleveland downtown, going to school there, and the biggest difference that we always talk about is the angry honk versus just a friendly how you doing honk.
Oh yeah.
So it's
Absolutely.
a big difference. So going into when you first got enlisted into the military, is that from Cleveland Clinic to the military?
No. So my story actually a little different. I needed a way to pay for college, right? And my wife and I come from a town that's effectively very similar to Quincy. Sort of if you replace the QND or the big Q on the respective football fields with the W, that would be Warsaw, Indiana. What I needed was a way to get out of town. I just, as wonderful as these experiences are, obviously you want to go out and see the world. And so I didn't have a way to pay for college. So I joined the Army through ROTC, and I had looked at the Naval Academy and went and did a track tryout and threw discus and ran for them. And I remember no offense to the Navy because they're wonderful, wonderful folks, and Annapolis is an incredible place. But the young midshipman that was talking to me at the time said, hey, it's great. If you come here, I get a car and I get to go off campus every 3rd weekend or something like that. And I just thought, oh my goodness, that might be a little bit limiting. And at the time, my girlfriend, who's now the mother of my 3 children, she was a year ahead of me in school. So she was a freshman at Indiana. And I walked into the ROTC office and said, hey, I'm interested in coming. And they said, well, that sounds good. And I ended up joining a thing called the Ranger Challenge, and ended up co-captaining the team the first year, and then ended up captaining my senior year. But after that they were like, hey, you seem to not be terrible at life, and you seem to be a good guy. We'd love to give you a scholarship. And I ended up getting a 4-year full ride to IU through the ROTC, which was a wonderful experience. Yeah, let me jump out of planes and blow things up, and it's never a bad day for an 18-year-old guy.
So getting into some of your military experience, when you first got So let me get the timeline. So you got ROTC, you got that scholarship to Indiana. After Indiana, you went to Cleveland Clinic. Is that right?
Correct. Yeah. Well, after undergrad, I took a deferment on my active duty service. I originally was assigned to be an infantry officer with what they call a branch detail to intelligence. So I would have done 4 years infantry and then transitioned at the captain level. Within a few weeks of that assignment, I ended up getting accepted to medical school. And so then I put in another packet, and you go through all the fun hoops of government paperwork. And so after undergrad, I went to Indianapolis for medical school, where I was for 4 years. And then once I did some training and things like that during the off times, and then once that was completed, went to and got accepted to residency at the Cleveland Clinic. I then went to Cleveland, where I was for the 7 years of residency. And then once that was completed, went to Fort Lewis, to Joint Base Lewis McChord, which is primarily sort of special operations post with, it's got the 1st Special Forces Group and the 160th Special Operations Aviation Reconnaissance, or SOAR unit out there. And there's a Ranger Battalion, and then a unit called the Triple Nickel, which is an engineering group, and it's the home of I Corps, which is one of the larger combat arms sort of divisions. But obviously they have the hospital, which is Madigan Army Medical Center. And so I went out there after I got out of residency and was there. I started out obviously as a junior partner and had a wonderful colleague who's a great friend, Fred Stevens, who was my first chief, and then he promoted and ended up moving his family back to D.C. And so there was an opportunity to apply to be the chief of neurosurgery, and so I applied and was selected to be chief of neurosurgery at Madigan, and served as chief of neurosurgery from 2019 to 2024. Sort of, navigated through the pandemic and all those fun experiences that we all went through in our own different ways. And then from 2017 to 2018, I was in Afghanistan. I left in the fall and got back in the spring. And I served as the director of critical care and trauma operations. Originally was just, I'm an Army guy, but I was assigned to Bagram Air Base in Afghanistan, to Craig Joint Theater Hospital. And originally I was sent as what they call a profis, or a filler. Basically, the Air Force ran out of neurosurgeons, and so they asked the Army if we could, pinch hit. And so they said, sure, we'd love to. And so off I went. And while we were there, our trauma czar, the guy who's in charge of trauma and critical care, was unfortunately injured. And so he had to redeploy or go home. And at the time, the hospital commander, who's the commander of medical operations in the country at the time, ended up calling me into his office and said, hey, you're the guy we're going to put in charge. And so here I was, a junior major, and was not only, in charge of Air Force folks instead of Army people. I was in charge of, other, colonels and lieutenant colonels and things like that who outranked me. But, I would just have to say everybody that I deployed with was, they were wonderful people. Everybody worked together as a team. It was really, really a kind of a uniquely kind, professional group of people, and everybody sort of helped out. And so I ran the critical care operations at the hospital, and it was sort of chosen because of that critical care fellowship I did while I was at the Cleveland Clinic. So I was the only one that had that. And so I ran daily IC rounds and oversaw the trauma bay and any of that sort of stuff, in addition to doing neurosurgical duties. So it was a really unique experience. A lot of great stories from that, but yeah, I think it was a very valuable experience. You sort of, when you're young and you're going into your career, like I think like the ink on my diploma from residency had barely dried by the time they were like, hey, you're going to go deploy. And I've got this young family at the time. We had, my wife and I had our daughter Caroline, our son Jack. Our son Will hadn't been born yet. But it can be daunting, because you think to yourself, wow, I mean, we've been in a country for 20 years, and sort of, if you will, the country, the U.S. hasn't won the war, so to speak. So what are you going to do as a single provider going over and doing your part? And I think it sort of speaks to the general picture of how do you make a difference in any community that you're part of. And what I realized as I sort of thought about what is my mission, what's my goal, like what is my purpose when I go over there, I realized that, as I talked about, my why is my wife and my kids. And that was going to be the hard part, right? I was lamenting the fact that I'm going to have to leave my wife and my kids for, 7-8 months, be around the world in a war zone, all this sort of stuff that goes through your mind as you think about it. And I realized I guess that really is sort of my mission. And so obviously as a single person going over there, I'm not going to win the war, if you will, right? As ridiculous as that might sound. But my mission would be that if I could go and bring even one person home, somebody's Susie or Jack or Caroline or Will, somebody's wife, I could bring one person home, having served the flag instead of draped by a flag, then I would have felt like I had successfully done my duty for my country and for the people that, I serve. It helped me focus my efforts and my energies to make sure that, when I was there, I could give 100% every day and, feel like I was doing something that mattered. So it was a really interesting experience. Obviously the night we arrived, we landed on the tarmac and there were mortars landing on the drop zone of the air runway. And so like, it's like, welcome to war, and they're like, all right, they got on the overhead and they said, everybody grab your gear and run to the tarmac. And so here I am, like the first night, the sirens are going off. I'm running across the cause you get off the airplane yourself, you take your own bags off. There's no such thing as a flight crew. So, we all filed off. I grabbed my rucksack and I'm running across this thing like, okay, here we go. Like ready or not, here we come. And then you pull into the airport, the terminal, and all the people that have been there just sitting there laughing and joking and hanging out, and and they're just used to it because mortars come in every so often, and you dive in. And actually, my wife used to think it was they were fire alarm drills every time they would go. She's like, "Oh, you got another fire drill?" I'm like, "Yep, sure, honey." And because I didn't want her to stress, but we would we'd step out and go stand in a bunker for a little while and come back in. And it was, but. That was sort of regular, everyday occurrence sort of thing. It was kind of interesting. I had at one point, I operated on a Taliban soldier. He'd been in a fight with our Rangers, and he got hit with a grenade from a distance. So it crushed the left orbit, the eye socket around his eye, and it had depressed it over the optic nerve. And he had lost vision. He was leaking spinal fluid and CSF out of his face, which obviously is a bad problem. But he slunk off in the woods and I think he got picked up somewhere by doctors without diplomas, and they stitched him up with pretty much baseball or shoestring, baseball suture, shoestring, something terrible because it was infected and gross. And he turned himself in, and he knew he would get the medical care from obviously the Western medicine if he gave some intelligence. And so he turned himself in, and I took him to the OR and did sort of what's called a bicoronal crani. So it's an incision from just in front of the right ear or the left ear all the way up and over the head to the opposite side. And then you pull the face down over the orbits. And I reconstructed the front of the skull and took all the sinus material out and decompressed the back of the optic nerve. And his vision went from it was some terrible number, whatever. I don't do eyeballs, guys. But it was a terrible number to much, much better. The ophthalmologist that was with me was very happy, but we reconstructed. It was kind of an interesting, unique experience because you realize again, what's your impact on the world around you, and you realize here's a guy that is, we're going to treat him, we're going to take excellent care of him and treat him like any other human being deserves to be treated, regardless of what his beliefs or his background is, and that's what matters, right? Is you treat people the way you would want to be treated, right? But what you realize is once you treat somebody like that, they're gonna step out. You're gonna put them probably in some jail for a little while they collect the intelligence, and then after a while, the jail's gonna fill up, and they're gonna let mass amounts of people out, and that guy's gonna be out somewhere, standing on a hill again with a rifle in his hand, and one of your brothers and sisters in arms is gonna be driving by or walking by, and that guy's going to have to make a choice. And so one of the things that they tell you when you deal with the Taliban or with the enemy is if you go in to talk to them, you're supposed to take all your identification off your uniform and your unit patches and your name tags and stuff like that. And I was like, what? Forget that. What's this guy going to do to me? First of all, I'm safe and protected where I am. But it mattered more to me that this person saw me as a human being. And I just, walked in and I said, look, you and I might see the world a little differently. You might have a different set of beliefs than I do, but I want you to understand that when you're here, I'm going to treat you with kindness and respect. And I said, this is all through an interpreter. The poor guy had to interpret really fast. But I said, I want you to look around the room, and I want you to look at every single person in here. And as the kid looked around, he's probably 20, 21, give or take. I said, I want you to understand every single person in this room wants you to do well and wants you to heal and wants you to get better. And he had multiple wounds. I mean, in addition to the cranial surgery, I was pulling bullets out of his leg and, out of his shins and so, cleaning out those wounds, all kinds of fragment stuff. And so there was a lot of stuff going on, but I said, I want you to look around, and I want you to realize that every single person in this room is here for you and here because we want you to do well and be healthy and get better. And I want you to remember that, because in 6 weeks, when they let you out of whatever prison they put you in, somebody's going to give you a rifle and they're going to put you on top of a hill, and you're going to look through that scope and you're going to see one of my brothers or sisters in arms, and you're going to have to make a choice. And I want you to make the right one. And when that moment comes, I want you to put that rifle down because you remember what we did for you here today. And I don't, obviously I didn't follow the guy around in life to know whether he did that or whether he made a different choice. But, you realize your decisions, the way you treat people, can have a direct impact on the world, right? I mean, by me showing, kindness and respect and taking care of this person and showing them that, though we come from different backgrounds and he may be taught something differently than I am and may believe things about me that aren't true or are different, that we're not always that different, and there's commonality. There's, if you look for the good in people, you can find it if you look hard enough. My hope is that when that time came, that maybe he made that right choice, because I think that can be the difference. If what I did kept him from pulling the trigger even one time, then there's somebody that went home to their husband or their wife or their partner or their mom or dad or whatever, or their children. Even though you're a single individual on this sort of focal mission of go be a neurosurgeon in Afghanistan, all of a sudden you find yourself in a leadership role, and you also have to, just in any experience that you have, search for what is the mission that you really need to accomplish? What's your why in any experience, right? So my why in life is my wife and kids, but my why when I was there was, how do I get somebody back to their family? And when you do that, I think it becomes very gratifying. And I think you apply that same sort of mentality when you get called into the middle of the night in the ER, right? I mean, it can be tough. Sometimes you get called at 3 a.m. and you'd rather be at home snuggled in bed next to your wife in a cozy warm bed, sleeping soundly on a nice night, but you realize you're getting called not because people want your help. They're calling you because they need your help, and it's sort of that responsibility that you have to be in a position where you get to take care of people and you get to have a positive impact. You try to apply it everywhere. I think they're good life lessons that you learn.
Yeah, for sure. What kind of skills, what kind of things do you take from your military experience, getting into civilian life, going into, having a hospital and having all the resources that you could possibly want? I'm assuming that whenever you were deployed, you didn't have all the bells and whistles that you have now.
Yeah, it's fun. Yeah, that's a great question. You obviously learn to improvise. Like I said before, you sort of learn to grow where you're planted. At one point we were taking care of a patient who needed, BiPAP sort of treatment, and we didn't have the equipment, so we ended up fashioning one out of a bag valve mask and some corrugated tubing, and then we connected it to a ventilator and put it all together. So it was just kind of MacGyvered things into place, which was a ton of fun, actually. And you learn to be resourceful, you learn to think outside the box and get the job done. One of the things I think just that all of that experience taught me is just a perspective on the world and how to look at people, how to try to find the positives in an experience. Because, in any of our lives, right, we all go through tough things and tough moments and tough times. And, the world can be divisive and can be chaotic and can be hard, right? And it's easy to fall into that mentality and see that all the time. But if you develop the skills and you practice the skills to find the positive, then, you can sort of, I think it makes life a little bit more pleasant and palatable, just because you can get through it without feeling down. And I think one of the things you learn in the military is sort of this resilience. They jokingly, they call it hunt the good stuff, which is a ridiculous way of saying it, but it really, it's a simple way of saying, like, look for the good in your day. And when you do that, I think it makes a difference. And I also think, obviously you get experience in leadership. There's actually formal training in leadership, and it's a passion of my own, personal interest and self-study of leadership and things I put myself through just to try to be the best leader I can be. And I think often in medicine, sort of it's an assumed thing that at some point you're going to become a leader. And as you graduate from a med student to resident to fellow to staff, it's sort of assumed that you're going to know how to take care of people and deal with people and lead a group of people, but nobody ever sits down and gives you like a formal education. Says, at least in my training in residency, nobody ever sat down and said, hey, here's how you deal with a group of diverse people, or here's how you lead a group of people that may feel, morally, ethically, politically, religiously different than you. Like, how do you find, the strengths that each person brings to the table and create a cohesive team that can function professionally and respectfully and, create that environment that's successful for the patient ultimately.
So that camaraderie that you kind of get being in the service, what does Veterans Day mean to you? What do you kind of think about on that day? And what's your message to, other veterans that are getting transitioned back into civilian life?
Yeah. Well, I think it's, you reflect back on your time and you want to feel like what you did made a difference. And I think for so many veterans, there is very much a sense of pride in knowing that you've done something for a nation that's obviously given us a lot. We're blessed by living in this country with the opportunities that we have that aren't naturally, available to every country in the world. As a veteran, I think number one, I'm very proud to have served. It's a tradition sort of in my family. My grandfather was in D-Day and actually had 5 Bronze Stars for his service in World War II. It's kind of crazy. We found his discharge paperwork. My dad was in Vietnam, and obviously I went to Afghanistan. So it's an interesting way, in a weird way, to sort of feel connected to some of your family members. But it's also, you feel like you've done something for a community and for a country that's done a lot for you, and I think that's important. Obviously, there are different experiences for everybody who goes through the military. Some people have really difficult ones. Some people have largely straightforward and less stressful ones. I just would say I'm thankful for anybody who's willing to step up and try to serve their country and give back in any fashion, whether it's the combat infantry guy or the special operator or the folks that are doing the linens and cooking the food. Right, everybody has a job. It's like everything in life. Everybody has something they can contribute to the world, and I'm just appreciative of people that are willing to to serve their country. And when you meet another veteran, it just, you sort of naturally have this bond, this thing you can connect with. So I just think on a Veterans Day, I'm thankful for the folks that have done far scarier, harder, more dangerous things than I, and appreciative of what they've, afforded me in terms of freedoms. And I hope that there are other people who, will come along and pick up the mantle that they sort of bravely took on. I'm glad that I had the chance to do what little I could do. It was a great experience, and I'm just proud.
Thank you so much, Dr. Brennan. You have some great stories. I'm sure you have plenty more.
Yeah, lots more. You probably don't have time for. Probably talked too much already. Anyways.
No, that was awesome, man. Thank you so much for coming in and doing this.
Thanks for having me.